I'm Gio, my co-host Sharam, and we are talking COVID and people. All right, so we were talking about the United States and the reopening process, and so that's where we will take the conversation. Uh, my perception is that most people who are like we've got about a 50 per 50 split between states that are reopening and states that are staying in lockdown, and it appears to me that some of that is political, which is an entire realm to delve into that I want to try and avoid on this conversation. And so what I've been really paying attention to is how are people treating the reopening, because from my perspective, like watching this from a disease response perspective, a lot of the reopening should be seen as very tentative. In other words, okay, we've got this disease somewhat under control. Let's see if we can get back to more economic activity without a catastrophic rise in deaths. That's the most optimistic perspective. And it appears to me that a lot of places that are reopening are treating reopening, maybe not even at the government level, but on the personal level, at the population level, you could say, are treating reopening as, okay, the disease is over, we don't have to worry about it anymore, we're getting back to business as usual. And I see no evidence in the data surrounding this disease that makes that belief accurate. I don't I don't see it. And so it will be probably horrifying and shocking over the next month to 2 months, because it's going to take a while for real sorry for reality to hit. It's going to take a couple months for reality to hit.
Yeah,
And so
yeah,
as this unfolds, we're looking farther into the future and trying to find ways to mitigate the catastrophe risk, like catastrophic risk. What are the things that could really, really break as people, like as we get to plague levels of disease problem? And that's where my thinking is about, is on the disease right now.
yeah. I see where you're coming from. So, in the last few weeks, a couple of things have stood out to me. One is how, in multiple zero surveys, we've noticed that there are antibodies in upwards of 10, 15, 20% of the population. Uh, of course, this is in pockets, but it's an interesting thing to note that you can have a significant double-digit percentage of your population carrying antibodies, which means they were or are currently infected. And that's interesting to note, because a lot of models that we initially had uh, would would have predicted that a lot more deaths would have happened by now if we had this percentage of the population infected. So what that tells me is the virus spreads is far more contagious than we had expected it to be, and the infection fatality rate, not the case fatality rate, the IFR, is far lower than we originally estimated. Of course, the IFR is still significantly higher than the flu, but the knowing that it's far lower than what was originally expected, that's, I would say, some silver lining. The other bit that stands out is how it might actually be possible to have an effectively running economy. Maybe not at full steam, but still fairly effective in getting essentials to people who need it, uh, meeting people's daily needs, as long as you take the right precautions, as long as you have enough capacity in your healthcare system, as long as you have ensured that you have done what you can to cut transmission at source, that you isolate currently active cases. So I would say it's more optimistic today than it was a month ago, given the same scenario. Of course, this still does not take into account the fact that a lot of cities might actually get this wrong entirely. Cities and states might actually get this wrong entirely and misjudge where their boundaries might lie and veer off the highway.
Yeah, that's kind of the concern is to some extent it doesn't matter the version of this disease that we're considering if we're talking about a far higher R naught and a lower IFR, or if we're looking at the higher I naught R naught model and antibody tests are actually thematically biased and so not reliable, and we should shelve those for future assessment and consider the like these closer to standard CFR that we have right now, which is 2 to 4% versus like a higher R naught, more spread among the population, and lower relative death rate of maybe 1% or 0.5%, down to maybe 3 or 4 times the flu, at the lowest end of that as an estimate. And that doesn't quite matter so much. Like the lower deaths would make an impact, but the R naught will push the number of deaths higher because it'll be harder to stop the disease and slow it down, which means there's more risk of overburdening. It's not a big enough difference that immediately sigh of breath. And then if you look at it as a global phenomenon, it's a much worse problem for a lot of places. Like if you look at Guayaquil in Ecuador, there's bodies in the streets, bodies in people's homes. They can't even deal with the bodies. There are so many of them. Their healthcare system is completely wiped out. But the problem isn't even healthcare, it's burials. They can't even bury people fast enough. And so it's going to be incredibly unequal in terms of death rate, depending on if you have medical treatment or not. And so the third world, the higher R naught makes a far worse disease because it will just spread so fast and they can't handle it. And the death rate's still going to be like 4 or 5%, because without treatment, it's going to be far higher. In West World, where you get people who are treated, then the death rate is far, far lower. So that might even be below 1%. It varies quite a bit on population health, though. Like the US is going to see a higher death rate than somewhere like perhaps Japan, which has a similar, like, older population. But everyone in Japan has a far healthier diet than the American standard diet, and are known for longevity and like maybe not work-life balance, but work-health balance. Like there's like exercise programs at work that everybody participates in to help with posture, and there's other things that the Japanese do that sort of boost the population health that mean that Japan will be far less hit. And then also there's the cultural stuff with Japan and how they treat infectious disease in terms of just their ritualistic habits of like taking their shoes off at the door, which significantly reduce spread of disease. And so there's no precise, this is the death rate everywhere. You can use this as an estimate. What you can do is look at what is the most reliable data. This seems to be the point, which makes sense. And then if we use that over here, this gives us a baseline where until we get data that supersedes this in reliability, we can work from this number as if this number is true because it's the most accurate estimate that we can work from. And that perspective is a lot of how I think about the disease, because the data seems to be incredibly, incredibly poor. when you look at it, it's systematically biased, and it's hard to know what is actually going on versus what are people perceiving to be going on.
Yeah, precautionary principle, right?
Yes.